Get started. If you guys way down there can hear me, thank y'all for coming out. It is a beautiful Friday afternoon here in Myrtle Beach, and thank y'all for taking some time to come and hear us talk a little bit about health insurance. My name is Steve Paget. I am a salesperson for Blue Cross, and my relationship or my focus is working with local chamber of commerce to drive local businesses through their membership with the chamber to enroll in health insurance plans from Blue Cross. So my working relationships is with the chamber. And then in that regard, once we have businesses that are looking for group insurance policies, we're going to connect you with your local agents here in Myrtle Beach to drive and make sure through your membership you're getting all of your benefits. And as we're going to talk about today, there are value add, look, just in time. Come on in. Fix yourself a plate, please. We just got started. We're going to talk about all the product offerings from Blue Cross in the 2 to 50 spaces where we're going to focus today. Does anyone here have a business that has more than 50 employees here? More than 50? More than 50.
I think we have 66.
How many are, what would be the number that would be covered from a health insurance?
Under 50.
Okay. And the reason I ask is because we do have products that are unique for larger groups. When we think about large groups, we use the number of 50. So if they're more than 50 employees, then there are unique product offerings from Blue Cross in that large group space. And if that's the case, we can certainly, we're going to focus mostly today on the 2 to 50, but we can certainly have discussions around for you if we get to where there's more than 50 in those unique product that are offered through the chamber. And that kind of brings the point up. One of the things that has really driven the small group space, and this is going to be hard to believe, was the Affordable Care Act that was passed more than a decade ago. And so what that changed is it provided an alternative in the individual market for folks to be able to go to the marketplace and receive financial assistance. Well, you may say, well, Steve, how does that impact small group? Well, a lot of the small groups that we're talking about, 2, 3, 4, 5 live groups, decided, let's go to send our employees to the marketplace, stop offering health insurance, and have them go to the marketplace. And so there was a period of time where that happened early on. There was a lot of that migration to the individual marketplace. Fast forward over the last 10 to 12 years, especially in the last 2 years, there's been a shift in businesses wanting to offer health insurance to their employees. Again, a couple of reasons. One, it's a way to attract and retain employees. So if you can differentiate yourself from your competitors because you're offering a quality health plan and it's provided to them through their employer, it's a tremendous advantage to you. Second, from a business owner standpoint, that money that you invest in your employees from a health insurance standpoint provides you some significant tax advantages because you're able to use those premium payment dollars as a reduction in your overall tax liability. So we've seen a real shift, especially in the last 18 months, combination of groups wanting to differentiate themselves, folks needing and seeing a change and wanting to be covered. Some of that came through with COVID, not wanting to be caught without health insurance in an unexpected pandemic. So there's been a lot of folks that don't want to go without health insurance coverage. And then lastly, in the last 18 months, what the piece that Blue Cross has contributed is we looked at the marketplace and said, okay, we had a single product that was a traditional small group product. It was based on the gold, silver, bronze model in the marketplace. And those plans were great, but they weren't necessarily priced at the best point. And there were some other products in the market that were needed by Blue Cross. So over the last 2 years, we've expanded that portfolio. So there are actually now 3 different products available for small business. And when I say small, what we're going to talk about now, under 50 employees. Now, I also tell you, you don't have to take a lot of notes because a lot of what we're going to talk about is in this brochure. This booklet is not designed to sell you the product that is best fit for your business. That's going to be on a one-on-one consultation with an agent to walk through what are your goals. This brochure is designed to tell you what are the product offerings and then what are the unique advantages that you get by being a chamber member. So it's not a sales piece, and you're going to understand what an ICRA completely is based on this. What this is designed to do is to walk you through the additional benefits of being a chamber member. And so that's what we're going to talk about a lot today, or what are the benefits of being a chamber member, because everyone in here is a chamber member, right? If you're not, we're going to ask you to leave. Just kidding, Shannon. We wouldn't ask anyone to leave.
No, I'll just go ahead and sign you up for membership.
That's right. It's an opportunity. So I'm going to talk at a very, very high level about the three products and the benefits. There are agents here. I can connect you with agents as well that work exclusively with the Myrtle Beach Chamber to help you look at options for your health insurance. So we have a lot of resources in Myrtle Beach to help you get the product that fits. And I will tell you now, this is the fourth quarter of the year is the perfect time from a business standpoint to look at health insurance because you have a lot more flexibility. There is a second product that's in our portfolio that's available to you that eliminates the participation requirement. And we'll talk about that in just a minute. So as you see here, there are three products. We're going to first talk about, we'll start in the top left, the Affordable Care Act. Those are the traditional plans. The gold, silver, bronze. It's called Business Blue Essentials. There are 38 different plan options. They are, think of it, they're metallic based. Gold, silver, and bronze. So the gold plans are the most robust. Silver plans are a mix between quality coverage and some affordable options. And then the bronze plans provide a little more cost relief, provide a little bit more of a member responsibility from a premium or from a payment standpoint when they use their insurance. But it's a broad spectrum. So the Affordable Care Act plans are now available for a 1/1 effective date without participation requirements. There is an open enrollment period mid-November through early December that it doesn't matter how many of your eligible employees enroll, we can put you in or write a metallic plan for you and you not have to meet the traditional 70% participation requirements. And what that means is if you have 10 eligible employees, normally we'd have to have at least 7 of them enroll. During open enrollment, that number can go down to 3, 2, even 1, because we waive that participation requirement.
Only this time of the year.
Only time of the year. That's why I say this is the perfect time to be looking at health insurance because you now have a couple of options. Those metallic plans, we've also done a lot of work around them to put them at a price point that is very competitive in the marketplace. I'll be fully transparent to you. Blue Cross is never going to be the least expensive, but there's value in what you purchase when you buy from Blue Cross. There's the nationwide network. There's the deep discounts when you go to the doctors. There's the customer service. There's the local representation that if you have a problem, you're going to call someone in South Carolina and they'll pick up the phone and they'll answer it and they'll solve the problem for you. So there is a value in that Blue Cross. Plus, we're the only carrier that's based in South Carolina. Have been for the last 75 years. So this is home for us. We go to church with everybody. We go to soccer fields, the Clemson or the Carolina football games. So there is a level of investment in the community.
What's the deadline to get those non-participation groups?
So as long as they are in I think, I haven't seen the date. It's probably around the 15th of December.
It is December 15th.
Yeah. So that's the cut.
It's one day after they will not.
Yeah,
accept.
that's also the date that for the individual plans when you have to enroll for a 1/1 effective date. Obviously, the sooner we can make a decision, the better, because I will just also, in full transparency, tell you this is the busiest time of the year. So the more we can do in November and in early December, the more likely we are to have everything set for a 1/1 effective date. It's a very good question. So that's the Affordable Care Act plans. Real quick, we'll touch on level funded. And the reason I say we'll touch real quick on those are plans that are available for groups that are a little bit larger. They have to have at least 10 employees. that are enrolled in the plan. Typically, it's going to be a group that currently offers coverage and is looking for some rate relief, because these plans are what we call not guaranteed issue, meaning we're going to look at medical claims history and we're going to do some traditional underwriting of the plans. So the rates are not the rates, and we can decide, you know what, the risk is too great on this plan, we're going to not offer a level funded product. Whereas we always have to offer a metallic product. It's called guaranteed issue in the metallic space. So if you ask, Steve, I want a group quote for metallic plans, we have to issue it. It's guaranteed issue. There's no underwriting. There's no pre-existing conditions. And the rates are the rates. You'll hear me say that. The rates are the rates. That's a good thing, but it also means the rates are the rates. And one of the things, reason we added benefits through the chamber was because the rates are the rates. We couldn't offer the same product to two groups of people and have different rates. So we couldn't do a discount on the premiums. So we had to add value or add benefits that are only available as a chamber member. And we'll show you what those are in a minute. The last product that we'll touch on very quickly as well is called ICHRA. If you know anything about insurance, we love acronyms. And ICHRA is an individual coverage health reimbursement arrangement. It's an HRA platform. And what that means is it's full small group coverage, in that the group gets all the benefits of the tax savings. They get to invest money for their employees in an HRA. In this platform, with an ICHRA, the employee then uses the money from the business to purchase an individual product from Blue Cross. So it's an individual, so each person in your group can be on a different plan, which is very unique. Under the metallic plans, they may have one or two options if we offer a dual option. In the level funded, they may have one or two options, but the group decides what those plan options are. With an ICHRA, each member of the group that uses the money from the employer chooses the individual plan from Blue Cross that best fits their needs. So it gives the employees a lot of flexibility as well, and doesn't require everyone to be on the same plan. From an employer standpoint, the other real benefit is you as the employer get to say, Steve, I can afford $300 per employee from a coverage standpoint, or I can do $400, or I can do $200. That contribution amount is set by the employer and not a percentage of the premium. So it gives the business the ability to set it as a budget item. 5 employees times $300. All right, it's $1,500 is the contribution from health insurance. Blue Cross then does the work on the back end to determine, is that affordable health coverage for the employees, or would those employees be better off to decline the ICHRA coverage because they're better off receiving a subsidy on the marketplace? And that's not a Blue Cross determination. That's an IRS CMS calculation. That's an affordability calculation that we do for you as part of the quoting process. So the employee, you're not required to do, there's no math involved, as I like to say. This ICHRA option is very appealing to groups that currently don't offer coverage, because it gives them a lot of flexibility in setting up that initial contribution amount. So we've seen a lot of groups, and it can go down to as few as 2 employees, and it only has to have, one of those employees can even be a 1099 or a part-time employee. They have to have 2 employees. What happens is, so let's say the business sets $400 aside for the employee. So now when we meet with each employee, their rates are gonna be based on 3 factors: age, geography, meaning the county they live in, and whether or not they're a tobacco user. So we ask for those 3 pieces of information. The other piece that will impact it is the premium, their salary, because we have to calculate affordability. Because if it's unaffordable, and what that calculation is, it's a percentage of their income after the employer's contribution. If the amount they're paying exceeds the threshold, it's unaffordable. So they go to the marketplace and they get a subsidy. If it's below that threshold, then it's deemed affordable and they should use the money from their employer to purchase health insurance. So it's going to vary from person to person. And when we do the quoting for it, each person gets it's called a minimum dollar of affordability, which is basically you have to offer this person this amount of money for it to be affordable. And we can alter the contribution amounts to meet that. And I'll use an example. There's a group that we worked with in Georgetown. The threshold for one of their employees to be affordable was $304. They originally were going to do $300. We looked at that and said, well, okay, this person's going to get left out or they're going to go to the marketplace if we leave it at 300. We adjusted it. Everyone went from 300 to 304 so that it becomes affordable for them to purchase plans privately from Blue Cross. And where that becomes an issue, where it becomes a benefit is there are plans in this ICHRA that are on the private market from Blue Cross that have the traditional nationwide coverage outside of South Carolina. So they have PPO coverage outside of South Carolina, which is a huge differentiator between these individual plans and what you see on the FFM. All of our plans on the federal marketplace, healthcare.gov, they're all EPO plans. They're only coverage in South Carolina or the service area. With this ICHRA, you have the traditional nationwide coverage. And that's a huge difference. And surprisingly, the cost is very minimal when you look at the two plan options. So let's take a minute and really talk about, so those are the products. And as I mentioned, the rates are the rates. Here's the other thing. Those plans are available whether you're a chamber member or not. Here's what's different by being a chamber member is each of those products has its own unique set of benefits when you purchase them by being a member of the chamber. So first, we'll touch on it's called Chamber Plus. And this is added regardless of the product that you look at. Whether it's ICHRA, level funded, or the metallic, you get Chamber Plus added. So when you work, thanks John. So when you work with an agent and they submit the paperwork, they're going to file it to Blue Cross using their agent information as a chamber member, and you're going to get this Chamber Plus added. It's preventive dental and preventive vision for your employees at no cost to the group. And what I mean by preventive vision, provides an annual eye exam for $20, and then it provides discounts for glasses, contacts, lenses, sunglasses at over 1,000 VSP providers in South Carolina. It's not full vision insurance because it doesn't offer the allowance for the frames and lenses. It provides a discount. The other part of that is the dental, and it provides 2 cleaning and exams for dentists, for dental cleanings and exams using any dentist you want. There's no network. You're going to pay the premium, you're going to pay the dentist for the visit, you're going to submit the claim, and then we'll reimburse you $60 twice a year for the exam and cleaning. Once again, it's not full dental, it's preventive. So if you need a root canal, this Chamber Plus benefit doesn't help. This is designed, think of it as, that's why I use the term preventive. It's preventive vision and preventive dental. It's added to the group at no cost. The group gets their own, they get a separate ID card to use for the Chamber Plus benefit. Regardless of which product they purchase, they get Chamber Plus. So we'll talk now about ICHRA. So ICHRA gets the Chamber Plus benefit. It also gets a reduction in fees. So I talked about that HRA, that health reimbursement arrangement. Normally there's a fee for us to administer that when we do the substantiation to make sure your employees are still covered with health insurance. It's normally $2.25 per employee per month or $25, whichever is greater. So if you've got a 2-life group, it's going to be $25. If you're a chamber member, the minimum gets waived and it goes down to $1 per employee per month. So it would be that 2-life group would now be $2. So you just save $23 a month on a 2-life group by being a chamber member. Multiply that times 12, it's $260 some in savings by being a chamber member. Shannon, I don't know if that covers completely the chamber membership, but it's a pretty good chunk.
Yeah,
Just by being a member, you save $260 in a fee that you're going to have to pay on an ICRA. So you get Chamber Plus, and you get the ICRA reduction in the administrative fee. And then the last piece is Blue Rewards. And Blue Rewards is a financial program that incentivizes members to do certain healthy things. Get a flu shot, have an annual physical or well woman exam, or a telehealth provider. Doesn't have to be Blue Care on Demand, which is included in all of our programs. It can be doctor's care. It can be your local PCP who has telehealth. We're going to incentivize them up to $150 per member to do these 3 activities. So if you've got a family of 4 and they do all 3 of these activities, you can earn up to $600 on a prepaid Visa card to use for medical expenses, co-payments, eyeglasses, hearing aids. The one thing you can't use this for is at the pharmacy. And it has to do with the place of service code and the merchant code, the way our vendor works. We don't want you to go to the pharmacy, pick up your diabetes medication, and buy a 12-pack of beer and a carton of cigarettes. The software right now we can't limit those kinds of purchases. But other than that, we are incentivizing them to do certain healthy activities. And I say we pay them because the flu shot and the physical or well woman exam is covered at 100% with no copay as mandated by the Affordable Care Act. So we're actually paying them to do these activities. The Blue Rewards gets added to level funded. It's also a part of our individual plans. So all of the ICRA products get Blue Rewards as well. So ICRA gets Blue Rewards, Chamber Plus, and the reduction in fees. Level funding gets Blue Rewards and Chamber Plus. The metallic plans gets Chamber Plus. Each of the products has its own unique value-added benefit. So there used to be a tax liability if you didn't have coverage. One of the things that has taken place since the Affordable Care Act was passed is there was a whole push, the whole repeal and replace. Republicans tried that for a long time and realized they weren't successful. They couldn't get it passed. But they did chip away at a few of the things, and the elimination of the penalty for having health insurance did expire. So there is not a penalty if you don't have coverage for individuals. Now, for businesses, they still, especially in the large group space, there's some mandates within that. But for individuals, there's not a penalty. And honestly, the penalties, when they were in effect, were pretty small. A lot of folks just paid the penalty because it was cheaper to pay the penalty. It was cheaper to pay the premium, or pay the penalty than the premium. But no, for individuals, you are not. There's not a penalty if you don't have coverage. Currently, there aren't any incentives for individuals purchasing through the chamber, and a lot of that goes back to the way the individual market is subsidized from the federal government, and there are 10 essential health benefits that are mandated that have to be covered in those qualified plans on the individual marketplace. And only those 10 benefits and things that pay and contribute to those 10 benefits are eligible for subsidy dollars. So if as a health insurance you add something that's not one of those 10 essential health benefits, you can't use the subsidy dollars for it. And so we just haven't figured out a way to marry those two together yet. When you cross over 65 and you are eligible for Medicare, now you've reintroduced it's an entitlement. Medicare is an entitlement program that was signed into law. So when you turn 65, you go to Medicare unless you work for an employer that has more than 20 full-time employees, and then you can defer, which I know sounds Greek, but it's true. The size of the employer impacts whether or not the person has to go on Medicare Part A or Part B. So there's two parts to Medicare. Actually, there's 3 parts. There's Part A and B, which is inpatient and outpatient, and then there's Part D, which is the prescription drug, because when we originally created Medicare, we didn't think, oh, seniors might want to have prescription drug coverage. So we added Part D. And then, just to confuse seniors enough, we said, well, let's offer Medicare Advantage and call that Part C. Honest to goodness, this is what happened. It's the way it's structured. So there are a lot of requirements around Medicare when you turn 65. So if you're on an Affordable Care Act plan with a subsidy, when you turn 65, you are required to go off of the ACA product, go from one entitlement to another when you turn 65. Medicaid is a whole separate component of health insurance. Medicaid is income-based, and it is in South Carolina, the cap, the ceiling for Medicaid and the floor for the Affordable Care Act, there's a gap. They're not the same. So you can make too much money to be eligible for Medicaid, but not enough money to be eligible for Affordable Care Act plans. There's a gap because we didn't expand. You hear the term expand Medicaid? We didn't expand Medicaid. It was expanded as a part of the American Rescue Plan to fill in some of the gaps. But back to your question about Medicaid. Medicaid is a income-based program for folks. The Affordable Care Act is a level, the Medicaid's typically a state-based program with federal funding. The Affordable Care Act is, in this state, it's all federal funded because we don't have a state-based exchange. It's a lot of words to say. We do the calculations from an affordability standpoint to determine whether or not you're eligible for ACA subsidies or ICRA eligibility. The determination for Medicaid eligibility is completely handled by the state. So you have to apply for Medicaid coverage separately to the state of South Carolina.
And do you
Within an ICRA, there are there's kind of two plan option choices within ICRA. There are traditional Blue Essential plans that are EPO, meaning they provide coverage in South Carolina and the service area. And what that means is, there are some providers in Charlotte that are in the network, providers in Augusta, Savannah are the main areas where there are providers that are outside of the state. That's the EPO network. Within the state, it has every hospital, it's almost every provider. Our EPO and PPO in the state of South Carolina are very, very similar. That's not always the case in other Blue Cross plans, but in South Carolina, because of the size of our reach in this state, they're pretty comparable. So the EPO Blue Essential plans are in-state only. We also offer in the ICRA space 6 plans that are what we call Blue Extend. So they have EPO coverage in the state. Outside of the state, they access the larger Blue Cross PPO network nationwide. So you have coverage as if you were in South Carolina in all 50 states.
And if you do ICRA, then how many plans are you allowed to offer?
Every plan that we offer, the employees can choose from. So they can look at just the 6 ICRA, the 6 Blue Extend PPO plans only, or they can look at EPO plans only in the state, or they can look at a combination. And you can have, let's say you got 20 employees, you can have 5 people on a Blue Extend Silver 1, and 5 people on the Bronze Extend 1, and 10 people on Blue Essential, or they can be all in different plans. It doesn't matter. Requirements is a process called substantiation, which means the employee is there has to be a monthly substantiation that the employee is still covered under an individual policy to be eligible to get the next month's reimbursement through the HRA. Blue Cross handles that auto substantiation for for folks enrolled in a Blue Cross plan of South Carolina. So if they're out of state, then they have to provide the documentation that they are in a plan every month. But if they're in South Carolina and they're on a Blue Cross plan, that seamlessly happens for them every month. They don't have to
But
do
they
anything.
do, another thing though is Accrue Health that does the administration will do that substantiation directly with the employee. So it's not something that the employer
Right.
has to take care of.
That's a good point. Thank you. That's a good point. Yes.
Okay, so I'm a small business owner and I have.
Congratulations. Thank you.
Provided Blue Cross BlueShield health insurance policy for 13 years for my employees.
Okay.
So I work with an insurance agent and we do the dance
Mhm.
every year. And, some years I cry buckets and go, oh my God, I can't believe we have a 10%, 15% increase, So we go through this every year. So he has not mentioned anything to me about the other two options, the level funded and the ICRA, which I know the ICRA is newer. The level funded, is there?
Yeah, so think of level funded as a hybrid between fully insured and self-insured. It gives you the ability to have a potential rebate if the claims expenditure is less than what's anticipated. But it also typically is for groups that are looking for rate relief. The other piece that you may be looking at, or that your agent is looking at now, is you may be on what we call a legacy product that's pre-ACA, that are plans that we don't offer anymore.
Well, it's a silver, so I'm on a silver, so I guess it's metallic.
It would be if it's got silver in the name, it's good.
Do you have more than 10 employees total?
I have, yes.
That are on the coverage.
Then you might be eligible to look at a level funded plan.
So the level funded plan, you said there is a minimum?
You have to have 10 employees on the plan.
They're taking the coverage?
Correct.
Yes, that you have to have 10 enrolled. Yeah.
Correct.
Okay.
And you can, like you said earlier, they're not guaranteed to issue like your plan is now. So, like, let's just say that you had 15 enrolled, and we went and said, hey, Blue Cross, they're interested in looking at a funded plan. Can you quote them? They're going to go ahead and take a look at the health of your group and say yes or no. And then they'll give you an offer. They'll give you an underwritten proposal, and the rates will depend on the size of your group, participation, and the health status.
Okay. So my policy renews in August of every year. So we've obviously renewed.
Mhm.
In
Thank
order
you
to
for your
get, like,
business.
the chamber discounts that you're talking about, is that something I can't do until it's rewritten or renewed in August of next year, or how does
If
that
you
work?
are already in a Blue Cross Blue Shield plan and you're a chamber member, they're supposed to do that kind of substantiation at your renewal date, but there's always exceptions. You can definitely ask to get put into the Chamber Plus program,
Okay.
and see if we can get that benefit added for you, but typically it should be done at renewal.
Okay. And my other question is, I don't know if, it's like, again, we do this thing where it's like, okay, well, we don't want our rates to go up this much, so that means we're gonna have to increase our deductible, and we're gonna have to not have this benefit, and not have this, so we can keep our premium where it's somewhat feasible. So, we do this whole
Right.
dance.
Uh-huh.
But the family coverage, we have people with dependents, including myself, is ridiculous. The amount of money that I'm paying for my children to have health insurance is absolutely ridiculous. So I don't know, are there any options like that would be better with that? Because I mean, it is like totally blows
Yeah.
my mind how much money I have to pay for their health.
So when you look at those small group rates, it breaks it down by employee only, because that's what the participation in those metallic rates, the 50% contribution is based on the employee only rate. So you don't have to contribute anything for dependents or spouses. So that's why when we break that out, we do it that way, because the contribution requirement is based on the employee only. But then on those proposals, there's down at the bottom, it says the rates for dependents. And so the way, and then you look at, do you roll them into a composite rate for the group, or do you keep them individual? There's a lot of different ways the groups handle that. These plans are structured the same way in that here's what it would cost for you as the employee, here's what it would cost for you as the dependent, and here's what it costs for you as a spouse, and then you add them together.
So basically what you have, because you have a metal plan right now, you've got age rates. So everybody, depending on their age, has a rate, right? The level funded plans are composite rate, like you were saying, it's like employee only, one rate, employee spouse, next rate. So that could provide you with some relief. But to answer your question, yes, there are things you can do to help give you some relief on your spouse and child coverage. You need to talk to your agent.
I will tell you, and I've said this a few times, unfortunately, in the metallic space, the rates are the rates. But there are things that we can do to help you there. They're absolutely, so that's my caveat, but then there is, maybe we have a conversation about how we can look to help you there. And then I want to be very mindful of you guys' time, so I'll stay here and talk at least until traffic gets bad in Myrtle Beach, but too late. I was going to say, too late. Go ahead, I'm sorry, go ahead.
I wanted to make a really quick statement about dependents, and this is true life, because I was paying thousands and thousands and thousands of dollars. I have 3 sons. They
With another
never went to the
carrier,
doctor.
not Blue Cross.
Never went to the doctor, except for physicals, because I have a son that plays basketball, and so somebody said, try bronze, and I was like, I don't know. They were like, try bronze. I saved a boatload of money with bronze, because if you have children, it's one thing if you have children that have health concerns, or they're going to the doctor, they're on prescriptions, but if they're typically healthy, I saved thousands of dollars on a bronze plan versus a silver. I know Blue Cross Blue Shield probably doesn't like to hear that, but I'm being
We don't care.
very
We don't care.
They price accordingly. They
You got, we don't care whether it's bronze.
But seriously,
There's a lot of options. I mean, you can look at, well, that's one of the things is how do they use their benefits? And that's where the option of the ICHRA may even be more appealing, because you have different, especially as your group gets a little bit larger, because they're going to have different utilization needs. So maybe someone wants to use one where they get to that, what we call out-of-pocket maximum sooner. It may cost a little bit more, but if they use their insurance a lot, once they reach that threshold, then everything's covered at 100%. So there are some strategies on how you use your insurance. And then you can also, if you're in a high deductible plan, you can offset your income liability by opening an HSA, a health savings account. So there are a lot of, and that's where I'm not just mentioning ICHRA but it is the most flexible, because it gives your employees more choice. Now, with that being said, all of these products are awesome products. And as I told you at the beginning, they'll never be the cheapest. But hopefully the value that's brought to it by your local agents that are here to answer them, help you walk through those questions and get you the best solution, as well as if you do have a problem, because invariably something's going to happen, that you call and there's a local person here that can help you solve it, whether it's here in Myrtle Beach, Columbia, or Greenville. With that being said, I owe each of you 9 minutes of your life back. I'm sorry, take an extra dessert with you on the way out. Thank y'all so much for coming out on a Friday.
oh my gosh, so good.
On the back of those brochures, if you need to get in touch with me, if you don't have an agent, I can help pair you up as well. Or if you have questions about how it works with the chamber, by all means, please feel free to reach out to me. But thank y'all so much. Have a great Friday.